Acne is the most prevalent skin disease affecting up to 50 million Americans. And while some over-the-counter products may help with mild acne, more moderate cases are considered a medical condition that is best treated by a dermatologist. So dermatologist and Sun Pharmaceutical spokesperson, Dr. Julie Harper, joins us now with the 4 elements that contribute to acne. So thanks for joining us.
Thank you, Jordan. I appreciate the opportunity to be here.
What exactly is acne?
Well, acne is something that none of us like, I can tell you that. I think most of us recognize it when we see it. So what we see on the surface of the skin may be little blackheads or whiteheads or red bumps or even deep-seated nodules. But what's going on under the skin is really plugging in that hair follicle from dead skin cells and oil. And that's what then contributes to what we see on the surface. We see it usually on the face. It can certainly be on the trunk. We can see it in almost every age group, pretty rare before the age of about 8 or 9, but we see it even up into the adult years, as we mentioned, 40s and 50s, unfortunately.
We'll get to the treatment for maybe some of those moderate cases coming up. Let's get to those 4 elements, though, that are the contributing factors.
Yeah, it's really important that we start with those because they become our targets for treatment. So we know there are 4 things that work together to cause acne. One of those is that plugging of the follicle. So the skin cells down in the pore are making too much dead skin, and it's also not sloughing off appropriately. So that's one of our targets. There's also inflammation. There is a bacteria called C. acnes or Cutibacterium acnes. And this is not an infection. C. acnes is on everyone, but people with acne kind of respond to it with more of an inflammatory response. And lastly, there is sebum or oil, largely under the influence of androgen hormone or male hormone in the body. So those are going to be our targets for treatment.
And how is it typically treated?
All acne has they have those same 4 targets. So we're going to be trying to target this, whether your acne is mild or even really severe. We may use different drugs to do that. And some of that is about potential risk of the drug. We like to start with topical medications, for example, especially in mild to moderate cases. We can use things like the topical retinoids for that follicular plugging that we talked about. We can use oral or even topical antibiotics for C. acnes, and most of those are anti-inflammatory. The harder part to target has been sebum or oil, because to do that, most of the time we're working through trying to block that androgen effect. And so if you think about that, if you do that with a pill, that's going to work very well in our females, but our male patients are not going to want us to block male hormone orally. So that one has been a harder target for us, particularly in our male patients.
All right, well, tell us about a new treatment.
The new treatment is Winlevi 1% cream. It's FDA approved to treat acne. 12 years of age and older. And it is a way to actually block those androgen causing hormones, but doing it only in the skin because it's a topical product. So the drug works in the skin. It does not give a full body effect. And so one of the important things is this gives me an option now to target sebum, not just in female patients, but also in my male patients. It's FDA approved, so we know that it works. We also know that it was safe. The adverse event profile was good. The most common adverse events happened in about 7 to 12% of people. And most of those were just local skin reactions, things like redness and peeling and burning on the skin. So overall, safe, well tolerated, and effective, and available now for women and men.
Well, if we want to learn a little bit more about it, where can we go?
Go to your dermatologist first, but if you'd like more information about Winlevi, and if you'd like to see the full prescribing information, go to winlevi.com.
And if you'd like to see this segment again, just head to our website, firstcoastliving.net.